There are more than 20 million children and adolescents in the U.S. today that are defined as being at risk. While the causes are many, the effect is the same. At-risk youth are less likely to successfully transition to adulthood and contribute to society in a meaningful way. In order to meet the evolving needs of this vulnerable population, community-based programs and initiatives that support the ecosystem of issues affecting at-risk youth, such as poverty, abuse, and mental health, have never been more important. Here in Colorado, organizations like the Griffith Centers employ a multidisciplinary model to address the root cause of systemic issues affecting at-risk youth and families. By providing comprehensive and holistic support, including outpatient mental and behavioral health services, therapeutic residential treatment, foster care, specialized education, and trauma support, Griffith Center's mission is to empower individuals to achieve their full potential and develop the skills they need to thrive.
We've really built sort of an ecosystem of mental health services, a real systems approach to looking at youth, their families, adults, the challenges that they're facing. We work closely with Department of Human Services, and often our families enter the system and they're really struggling. Parents left their children, but sometimes they're struggling with substance abuse, they're struggling with housing, they're struggling with not being able to find a job. And then you've got generational trauma sometimes. And so we've really learned that one thing affects another. So building those resources to support children and their families is critical. These kinds of challenges and issues can create a feeling of helplessness, emotional bankruptcy. And so at Griffith, we're really committed to provide that hope and healing and resilience for these families and children, to provide that hope so that they can move forward and be successful in life.
Griffith Centers offers a variety of interventions and services throughout the state of Colorado. We work to provide multi-systemic, multidisciplinary services, supports for our families, for our clients. We work with outpatient and mental health-based services. We work with family preservation, intense interventions. We provide residential treatment for families and youth that are experiencing the need of a higher level of care. We also provide support for adults with intellectual disabilities, and we provide day treatment school options for those youth that are needing to stay in the educational system, but also need additional supports. Another unique characteristic of Griffith Centers as an organization is that we provide community-based services for our clients and our families. We bring the mental health and behavioral health support services to the communities and the schools. We also provide in-home services for those families that are experiencing other barriers to access care.
Believing that it takes a village to support at-risk youth and families, Griffith Centers is deeply rooted in the communities it serves across Colorado, with locations around the state and even reaching into rural areas. The organization's impact is creating lasting change, says County Manager Noel Bernal.
The impact that I've seen from Griffith Centers, both locally and statewide, is that they have embarked on a growth strategy for meeting the needs for mental and behavioral health. In the metro area, we have higher levels of socioeconomically challenged families in our county. So we have a major need for that at the state level here, but certainly for us within the local level, and I'm speaking for Adams County, we find that the number of providers who can do the work that Griffith Centers does and that can act independent of significant funding from the federal government, the state, even locally, is a major asset to us. The fact that they're able and have a vision for being that partner for communities and for government entities like us really allows us to then build a network that is strong and that we can rely upon to provide those various services that we're seeing our community need.
It takes a village, to help our family and community. It's critical and essential that we work with community partners. We work, for example, Department of Human Services. We work with our school districts. We work with smaller nonprofits like Precious Child, The Flying Horse. All of these different organizations support our families in terms of hard services, housing, food stamps, clothing, just anything you could possibly imagine Griffith, over the years, expanded our community-based programs across Colorado. And the goal for that expansion was really to service the rural areas. I mean, one thing that we identified, particularly working with Department of Human Services, seeing the need of teen violence and substance abuse in our rural areas, is that we had to make a difference. We had to expand services in those locations, and most recently, we are providing telehealth in all those locations to expand our reach.
Founded in 1927 with the simple vision of inspiring children to believe in themselves, today Griffith Centers continues to be a beacon of hope and healing to more than 2,000 individuals annually. Although times have changed almost a century later, Griffith Centers is committed to meeting the evolving needs of communities around Colorado, changing lives now and generations to come.
I was involved in therapy with Griffith Centers, and over time, they've helped me achieve what I didn't think I'd be able to achieve with especially my childhood and how I grew up. I wasn't a very happy kid. I was really angry. I was frustrated all the time. They found me a therapist, and it helped me achieve the goal that I've always been wanting to achieve, and I probably wouldn't be here today if it wasn't for Griffith Centers. I started doing good in school again. It helped me become a better person. It showed me that my past didn't define the person that I had to be today. And I've proven my parents wrong. I'm not repeating that generational trauma. I've broken those habits, and I want to make sure that I don't repeat that. And Griffith Centers made sure that I had a path I could follow.
Emily Griffith in 1927 established the residential home for boys in downtown Denver. And I'm proud to say it today, we still try to keep not only true to her fidelity, but we've expanded service over the years to really meet the needs of our community. I think we've made some incredible changes. The one thing that I think has been so critical is seeing what's happening in our world with our youth and our families. When we talk about innovation, it's staying in touch with the needs of our youth and our adults and our families and seeing what needs are out there. We're a nonprofit that's been around close to 100 years. We see you, and we're here to be here for you and to help you. And you can walk through our door. This is the whole community center that we're building right now. And you're going to have a safe person that's going to come and help you and support you and walk beside you through your journey.
Griffith Centers. Hope and healing starts here. To find out more, please visit griffithcenters.org.